Hi, it's Kelly Buchanan. I'm going to show how I put in a IV and do a medicine push. So first thing, we're going to go to the patient's medical record and our medical chart and look to see if what the doctor's order. He has ordered to put a IV in on this patient and do a medicine push. So first thing, we're going to see if there's any allergic to latex, antiseptic, or anything. I'm also going to ask the patient just in case. And then we're going to follow our GPSP and do our 11 Medrites and 3 checks of the patient. So first thing, we're going to go get our stuff. We're going to make sure that our IV, normal saline, make sure that everything is not out of date, anything is not leaking, and our collar's right. Grab our tubing. So now we got our stuff. We're going to go to the patient's room, knock on our door, introduce ourselves. Hi, I'm Kelly. I'll be your nurse today. I'm going to put an IV in you, and I'm going to explain if you have any questions about it, or if you have anything issues what to do, you can let me know. Are you allergic to anything? About latex, antiseptic, or anything like that. If not, then we can continue and get our stuff ready for our table and everything ready for the patient. So first off, I'm gonna wash my hands. I'm going to tighten this up, and then I'm gonna check and see if there's anything, and I see it perfect. I'm gonna check the pulse. Okay, great. So now that we did that, I'm going to take our cleaner, antiseptic, and go up and down and wait for 30 seconds. While I'm doing that, I'm going to wash my hands, put my gloves on. I'm going to get my IV bag ready. Make sure you don't touch it. And make sure the bottom don't touch either. And make sure this is clamped. Okay, this is clamped. I'm gonna turn it, hang it. Also make sure you calculate your time for med math, and make sure everything is correct and the rate is going down. I'm gonna let this go, let all the bubbles out. Okay, all our bubbles are gone. And now we can put this up here and wait. This is probably already dry, but what we're gonna do, we're going to clean this up. Clean it. Take our saline water, screw it in. We're gonna unloose this. Don't try to touch that. And we're gonna fill it. Make sure. Okay. So now that it's filled, we're gonna lock it. Lock it. And then we can put this into here and hold it. Okay. So now I'm just gonna do again, clean it. First I'm gonna put this tightener. Okay. And then I'm gonna take this, and then I'm going to fill again, make sure, and then I'm gonna clean it again for 30 and let it dry 30 seconds. I'm gonna take my IV. Pick my IV. I know what I do, I pull the vein down. I pull the vein down usually, and then grip to make sure the belt is up. And then we're going 10 to 15 degrees. You'll see a flash of the blood. So you're gonna keep pushing. And you're gonna hold that, let that go. And after that, you don't want to tape it yet because you're about to flush it. And now we're gonna flush it. Well, first we're gonna pull this back and see if there's any color in it, and then we're gonna flush it. After we do that, we'll let this go. Tape it. I don't like that tape. And with that, we're going to take our transparent tape, put them on there. Then usually what I do, I tape this piece right here. Proxy record.
Do you have
So then after that, we're going to take this piece and then we're going to connect it. Usually what I do, I usually clean this hub and put it together and squeeze.
It's very important that you clamp your tube. You want to make sure that the clamp is off.
Usually I like to tape it up here. Okay, now that we have that, I'm going to take my gloves off. Got that drawing. I'm gonna take my gloves off. I'm gonna wash my hands. I'm gonna go document that I have put this in here. Get everything ready, and then I'm gonna let the patient know, come back in 30 minutes to check on it, make sure it's not irritated or anything going on. After that, also make sure that you put your initial and everything on here, and everything when you put this on, and initial on here, the medicine you're giving, the gauge and everything. Make sure that no lost communication and everything is correct. So now that we did that, I'm gonna come back to my computer. Now the doctor ordered a push med through the IV. So now I gotta get my medicine. Let's say that we're gonna put medicine in this. We're gonna also calculate our rate. We're gonna also have, usually this is already ready for us for the medicine. It already has like the label and everything that we needed. We'll scan it and make sure. I'm gonna come to the patient's room and let the patient know, hey, I know we just got done, but the doctor wants to put some medicine in this to help it. He said it's okay. So that's great. So now we're going to do hand hygiene. We're going to wash your hands, and then we're going to put gloves on. And you always have a hub just in case. So now that we're here, we can lock this. We'll close this part right here, pinch it, and then we're going to flush. Where's my flush? So we're going to do a flush first. I think I already did this. I'm going to clean it just in case. Flush a whole 10 cc, or follow what the hospital says. Usually you can do like a half flush and then med and then the other half, but just for safety we're going to do the whole one. And then you're going to follow the rate, what you calculated, and rate on your watch, and do it as what the thing says. So we're going to watch. So let's say it's every minute you push, minute, push, minute, push. After that's done, we're going on to clip this, the medicine, and now we're going to flush. You're going to flush the same amount of time you did with the medicine to make sure you get everything out. So now we're going to flush, minute, flush, minute. And the reason why I'm doing flush a minute is because to make sure that I'm going the same amount the medicine, so it just doesn't go straight into the vein. So after that, we did that. We're going to take this off. We stitch. We're going to clean the hip, and then we're going to put this on there. So now we can continue, unlock this, and then they can continue what they're doing with the medicine. So thank you for watching, and I'll see you later.